should we use a more broad-based term like musculoskeletal therapist? Does that better encapsulate what we're doing? And on the flip side, people are saying if we change the name, we may lose several aspects that we feel are important to the name itself. And that is the historical perspective of where we've come. We, whether we like it or not, we've come from the placing of hands on a person and obviously using techniques, manual techniques, hands-on techniques to try to create change and modulate pain. The way that we've obviously learned about technique driven care has evolved greatly, especially over the past 20 years. And so I think that's why the conversation comes up. So, number one, we have a historical perspective. Number two, I think the big piece is that we traditionally have done such a horrible job at really messaging behind what orthopedic manual physical therapy is. And I feel like the tide is turning. I think folks like Jason Silvernail, Roger Carey, Chad Cook are some of the folks. Damien Keeter is another one who are really pushing us to say, what are we really looking at trying to say that we do as orthopedic manual physical therapy practitioners? And Jason Silvernail et al.'s work, obviously you're very familiar with their updated definition, I think is, to me, is one of the most seminal papers, at least in my world, to say, look, we're now defining what that looks like. And so I don't know if changing the name will change really what we do, because it still doesn't change the definition of the standards of what we have. And so I think manual therapy to me is like that historical perspective.